My name is Abbey Fingeret. I am originally from Pittsburgh, Pennsylvania. I went to Cornell University for my undergraduate training and moved on to medical school at Drexel University College of Medicine in Philadelphia. I then went to a general surgery residency training at Columbia University in New York and have just finished my fellowship in endocrine surgery at Massachusetts General Hospital of Harvard University in Boston. As an endocrine surgeon, I treat diseases of the thyroid, parathyroid, adrenal, and pancreas glands. The most common condition that I treat is thyroid cancer. I also treat a variety of benign thyroid conditions like toxic nodules, which create too much thyroid hormone, or Graves' disease, which is an autoimmune condition where the immune system triggers the thyroid to make too much thyroid hormone. With parathyroid glands, I treat both primary and secondary hyperparathyroidism, which are conditions where the blood calcium levels are elevated because of abnormal growth of parathyroid cells. And in the adrenal gland, I treat a variety of benign as well as malignant conditions, most of which lead to overproduction of certain hormones that are made by the adrenal glands. I consider myself a problem solver. I like to look at the big picture, not just there is a cancer in this organ and therefore I must remove it, but really understanding the physiology and the complex processes and the feedback loops by which the thyroid speaks to all of the other organ systems in the body, and understanding what that organ does and how it interacts helps me to counsel patients and really understand what their lives are like when that organ is removed. When I sit down with a patient for the first time, it's very important for me to get to know them as a person prior to understanding the other complexities of their medical problems. Frequently, when I meet someone, it's on the worst day of their life because they're learning for the first time that they have a cancer diagnosis. And that information can be overwhelming. In a way that strikes fear and panic and hopelessness and doubt. And so I find that getting to know people on a personal level allows me the opportunity to understand how that news is going to impact them in their day-to-day life. One of the things that I love most about Nebraska Medicine is that in addition to being a tertiary academic referral center, it is first and foremost a hospital that cares about people. I was very attracted to the mission statement here that patients always come first, that people always come first, and that a person comes to us with a problem. They are not that problem. There are not a lot of academic medical centers that afford a clinician the opportunity to treat people as people and also to provide culture-changing science, to be able to pursue research that changes the way that we prevent, diagnose, and treat, and hopefully someday cure cancer. And that is really my ultimate goal, is to first and foremost be a clinician who cares about her patients, and secondarily to change the landscape so that we can fight and hopefully win this battle against cancer.